Is that the one with the sponge on the end?
It is a little sponge. It almost looks like Kittners, but they are endo Kittners. Endo peanuts. Okay? Sometimes they use this to dissect. Okay, or retract sometimes. This is a disposable hood cautery. Okay? All these items are disposable. This is a disposable clip applier. Okay? Oh, we still have some.
Yeah.
And they come in 5s or 10s. Okay? Most laparoscopic stuff, standard is 5 or 10. Anyone know what this is?
Is that a negative pressure wound?
Don't make it
Yes, don't make fun. Yes, it's right. It's Clarify. Okay. Fun. Yeah, it's called Clarify. Most people call it igloo. It's got solution in there. There's a power on button. I'll show you guys.
It's like a stroke warmer.
Oh.
There's a, so you gotta pull this out, and I don't wanna do it because otherwise it's gonna leak everywhere. There's a power on button, and then the blue light will light on, then you can warm your scope in here, okay? This is surgeon's preference. This part is to like kinda clean the camera, so once you stick this in, you take it out, then you just kinda dry it up here, okay? And fun fact, this was designed by a surgical tech. Yep. And that person is very rich right now. Yeah. So this is the scope cleaning sponge that you can. So for trocars, you can stick this guy in to clean up. Okay. And normally it just comes with it. This is another cleansing wipe, but you can use Ratex because these normally we toss it out. Otherwise you have to count them. Okay. Do you want to tell them about this?
All right, so a couple different kind of trocars we have here. You can see these this is natural long trocar. And what this does, it's like a balloon trocar, so it blows up once we get it inside so it doesn't come out. Okay, this one's gonna do the same thing. It's called a Hassan though. So when we put this one in, this actually comes off if you want, and it'll be a regular trocar. And put this on and we lock it down. Once we get it into the incision site, we'll take suture and wrap it around here to keep it in. Okay, so 2 different trocars, same thing, different ways to do it. Okay, and then we have our longer trocars for our fluffier patients. And then we have our regular size trocars. And like Sherry said, usually 5, 10, there are 12s and 11s. We use an 8s for the robot. We use 8s sometimes. So there's different diameters of trocars also. But most of the time we'll use 12, 10, or 5s.
Any questions on this? Some facilities, they do still have the old school version where it's like non-disposable. So we actually take the pieces apart, but we don't have it. I can go ask Chris, but I don't think we have it here. Maybe I can take a picture from the hospital and I'll show you guys, okay? But normally now it's all disposable. So we do create a lot of trash. All of these are reprocessable, so we can actually send it back into a bin and they take it back to the company. Covidian, they'll take it back and then they somehow fix it and they can, make it work again. So there's that process. All right, so you guys, here both rooms have 2 monitors. Part of the circulating rule, you want to make sure you turn on all the monitors. Okay, so 2 monitors, same thing with OE. Cord management, and this guy is a video recording, picture capturing device. Okay, so it saves pictures, videos, and you can download them and print it. We don't have a printer here, but this is how it works. So every time when there's a new case, you want to hit new case. And then you will show that. Can everyone see that? Yeah? Okay.
Would you mind showing that again, just for the camera purpose?
Yeah.
But you guys won't have to touch that.
Yeah.
You won't have to touch
Yeah,
that.
I'm just showing you. Yep. So new case, but this is how you'll see. Okay. This is the light source the camera.
So the circulator just turns it on?
Yes,
Turn
you
it
wanna
all
get
the
everything
machines
turned on.
Yeah,
Okay.
all the machines will be off when you guys come in.
Okay.
Okay, this is the laparoscopic camera, and this is connected to the integrated system. Okay, this guy here down here is the light. Okay, and this is insufflation. All right, any questions?
Does any of this actually work?
Yes,
They all
everything
work.
works
Yeah.
except for the insufflation
Yeah.
because we don't have
We
a
don't
flat
have-
gas
yeah.
supply.
So for the test,
Mm-hmm.
do you want all that stuff on top for a case card, or
No,
is that just to
that
show
has
us?
nothing to
There
do
will
with
be
your
some
test.
stuff,
Yeah.
but this is, I just wanna show you guys what we have.
Okay.
Yeah. Again, same thing, suction, there's Bovie, same old for the previous test, okay? This test, I want you guys to practice with arm boards, so patient will be supine arms out. Alright, making sure you have the pedal for the surgeon, okay? And then you guys can come closer up here so you can see the setup. If you guys wanna take a picture.
I don't have a towel roll up there. We don't have enough instruments where we actually need a towel roll, but you can put a towel roll up there if you want to.
For the mirror?
Yes, for your male can, yes.
Okay. I was about to say, T, that is a towel roll, so, okay.
Oh, just for that one?
Yeah, okay.
Just the one, I'll let you.
Okay.
You guys wanna come around and take pictures? Let people come by of the setup?
Take our top off, hand it to our circulator. And then usually you're gonna pick your scopes up, check under the Kim guard like we always do, holes, moisture, bioburden, that type thing. I don't want you guys taking the scopes out before you come over to the table. These scopes are like $2,000 and that's refurbished. And if you drop it once, it messes up the optics on the inside. So please be careful with the cameras. Bring them over. You wanna use all three? Well, you can bring them out. I'll
yeah, I
just
can
use
bring
that
them,
one.
yeah.
We have a couple different kinds. Same thing with scopes. 5 millimeters, 10 millimeters, and then we have 0 degree, 30 degree, and 70 degrees. 70 degrees we use for urology, but 30 and 5 is what we use for this procedure. Okay. Down right there. Here's our camera cord. Same thing. Check. Have your circulator check the filter. The black one right here is our camera cord. Same thing, make sure you guys keep a hold of the camera because if we drop it, no telling when we'll get a new one. Okay, light cord. Okay, now when you guys put this stuff on your Mayo stand, you want to make sure that it's neat because once you get up here, if all these cords are wrapped up there, the doctor's going to be pissed. Okay, so we want to make sure we have our cords where we can just take them off and get them put on the field, okay, properly.
Yeah.
Circulator. All right.
Let's use the 530.
Oh, the 530.
Yeah. All right, so as far as for laparoscopic instruments, I just wanna go over a few things. If you guys wanna come up close. So, the standard common instruments that we use, these are the Prestige. I'll set it down here if somebody wants to take a picture. They look like alligator graspers. What it does, it can lock and it can retract.
That way you can hold on without
Okay.
having to keep your fingers pressed the whole time.
This is a Maryland. Okay, you want a picture here? And Maryland essentially is more for like dissection, so kind of like isolating the artery or duct or any kind of structures, okay? This is a METS, but it's laparoscopic METS, okay? You guys wanna take a picture? Okay. This is a Hunter. It's just a soft tissue, kind of like DeBakey.
It's less traumatic
less
than
traumatic.
your Prestige.
Okay.
Are you saying Maryland like the state or like Monroe? Just for my spelling.
It's Maryland.
Maryland.
Like
Maryland.
state.
Yeah.
Okay.
Maryland. Okay. And then we have different type of suctions. that you'll see, this is a 10 millimeter suction tubing that connects with the suction irrigator. 5 is in our kit, which we'll show you guys later. It's a disposable item. Can anyone tell me what this is?
Is it, heating? I can't tell.
You're close.
Yes.
It's not.
It's not.
Can I
It's
open
not.
it?
Yeah.
Oh, it's not a heenie. It's, a Hagar, maybe?
It's a needle driver.
It's just a needle
Just
driver.
needle
Yeah,
driver?
needle driver. This is a
Laparoscopic
needle driver, so you can sew inside.
Oh, okay.
Okay. What about this guy? Yep. Endo Babcock.
So if you notice, some of these instruments are just like our handheld instruments, same thing.
Tenactin. Yep.
So endo tenactin?
Exactly. Everything you just add an endo to it.
Okay.
What about this guy?
Endo malleable.
Close.
Endo.
So it's an endo fan, so it retracts.
Oh.
Sometimes you can, so they would go into a 10 port, then you can retract the liver or retract the bowel.
Okay.
Keep it out of the
Yep.
way.
And, let's see what else they got here. Okay. This is, I believe, in your book too. It looks like a scissor.
Yeah,
It's a shear, so it's a hook scissors. So, yep, so most doctors, they'll either use the endo mets or hook scissors. Okay. And then we have this guy. This is a harpoon needle. So it's a needle that sometimes it'll drain the gallbladder before getting it out because
Yeah,
it's too large
aspiration
or
needle.
too inflamed. Okay, so this will connect to a 50cc syringe. Okay.
syringe.
Yeah, it has a lure lock on the end, so you just put the syringe on the end of it and then draw out.
All right, and this is another type of suction. You want to put it here? Here. I know Allison always takes. You want to take it here?
You said just suction?
Suction.
Yeah, just a suction. Suction
Yeah.
tip.
Because you notice a tip, it's got little holes on there. It's kind of like her suction. And then I think that's it. These are all the same stuff.
So-
Okay.
If the doctor asked for the 50cc suction, do we attach
You'll,
it?
Yes.
So you'll ask the circulator to get you the peel pack because they're all peel pack. Then you will open it up and hook it on here and hand it to the surgeon.
Okay.
Okay. Yep. All right. So I'm showing you everything in the pan, but we're not going to use everything for the case. Okay.
Are those new pickups too?
These
Oh,
ones.
just absence and teeth.
Oh, okay.
You guys know this from, tooth, exactly. You guys know this from general. All right, I'm gonna put some of this back.
In this case, you guys, usually it takes longer to set this case up than it does to actually do this case. It's not a long case. I mean, there are sometimes where we have difficult anatomy, that type thing, but this case usually goes pretty quick. The docs are pretty quick.
What's our setup time for this one?
10 minutes.
Okay.
10 minutes.
This is where you say just kidding.
No.
For
10 minutes.
real.
You guys can set this up in 10 minutes.
Yeah.
You guys are setting the bowel section up in 14 minutes.
I know, but then you just said it takes longer to set this one up.
Yeah.
It takes longer to set it up than it does to do the case.
All right. Any questions on the setup? And we'll go over it again. After you guys get into groups, we'll do it again with you guys. But just kind of the general.
So the new instruments that we
good.
have in this setup, those are gonna be in our new instrument set?
This
Yeah.
is these are all
These are
from
all the
major
same,
set.
peons,
Yeah.
cryos.
We haven't had these
Yeah.
Is that non-perforating or is that?
Yeah, it's
That's-
just a
This
non-perforating
is a
towel
towel
clamp.
clamp.
Okay.
Yep.
Yeah.
And then
All
we're
of
just
these
calling those S
instruments-
retractors?
Yep, these
Yep.
are S retractors.
All these instruments you guys already know from general, pretty much. It's
Okay,
all the same
just
stuff.
non-perforating towel clamp for those then?
Yeah.
Okay.
What retractors are on the mail?
S retractors?
S.
So you got, these are S retractors?
I think that's the only thing we haven't
Yeah,
had.
that's probably about the newest thing you guys have. You guys know the rest of these.
Okay, as far as for sutures, whoever's taking the notes, I know you guys always do a big group thing, but it will be O, Vicro UR6.
Right, we just don't have any old like.
Okay. For this particular procedure that I'm showing you guys, I'm just gonna use chromic because we don't have Vicro UR6, okay? But we have the same shape of the needle,
Okay.
okay?
What needle driver is that?
We only
Just a
have one
regular
needle
needle
driver in
driver.
there, and it's a small needle driver.
Yep.
Okay.
And-
to pull the attachment?
Yes,
yes.
correct, yep. And then monochrome for scan, the
Okay.
usual, okay? We're adding in, you guys know this?
Fred?
Fred, exactly. You finally get to count it.
Yay.
Okay.
Is that a separate scratch pad? So we got two now?
Well, it's not a scratch pad.
Well,
This
it's
is-
a soft pad.
Yeah,
but
yeah.
do we
It's not
count
a
it?
scratch pad.
We
though.
don't count it?
Yes,
How do we
it's
This
count
is
counted.
Fred,
No, but like, is it comes with two then, so we count 1, 2?
We count that
Fred?
3.
yeah,
Oh,
Because the
later.
top, some
Yep.
some facilities will count it 2 with the bottle and the pad. Some count
Yeah.
it with the cap, the
yeah.
bottle,
And
and
Tia and I,
the.
we're gonna count once we pull up, so we
Yeah.
wanna show you guys that part too, okay? We'll do a soft count before we start. Alrighty, any questions before we start draping? I'm gonna have you guys all move back so we can pull the table this way. Good?
Yeah.
Alright,
We didn't do an initial count.
Antonio.
we'll count once we drape. Uh-oh, that's folded all weird.
Lester didn't do that.
So for this one, you guys, when you go to tuck this, you need to pull this out over the armrest, okay? And once we give it to anesthesia, the circulator can come and from underneath fix this for you,
Yep.
okay? So that it goes over the arm board.
And this is where we talked about the T shape, how it covers the arm
Yeah,
board.
see, we hold it up, it's a T shape, so this area right here is gonna come out to cover the arm boards.
Alrighty, okay, let's pull up and plug in all this stuff.
Might grab my kit bucket, please.
So again, for this particular procedure, the surgeon will only touch the light handle. So cord management will be part of your test, okay? You guys kind of got a baby version last test. So again, this is just adding 4 more cords to it, okay? And then Antonio, you wanna come on here?
Alright, so, make sure you know the ends of the cords. What end goes off and what end we keep. Okay, cause, I've done it before, get in a hurry, throw off the wrong side, we can't use it. Okay, so make sure you know which end is going off and which end isn't. And I'll take the cords and usually put them down here, like underneath the Mayo stand, just to make sure we have room to move the camera all sides, okay? Just like if we were putting our Bovie and our suction up, same thing.
So the side with the blue thing goes off.
So, for this one, if you look at this, this is where your camera's gonna fit in. So this is the side we're gonna keep.
How's it go?
This one right here is the side that's gonna go into the camera, the camera box,
Okay.
okay? So if you look at this one, it's longer, and it also has optics in the front right here. So that's the side that's gonna go to our camera box. This side is gonna connect to our scope, okay? All right, once we have that up here, we wanna use these little things, and these are more important in laparoscopic, than your regular, because we have a lot of cords we're gonna need to secure.
So we'll have a drape like that in both ORs for this test?
Huh?
So we'll have a drape like that in both
Yes,
ORs?
everything you have
Yep.
in here, you'll have over there.
Yep,
Okay.
and sometimes, some drapes don't come with pockets.
Yeah, that's what I
So,
was
right,
asking,
so
yeah.
you will have to figure out how to core management.
Okay.
So that's part of core management. Okay, and you guys real quick, whoever's recording, come close. So with this light cord, you have to twist the knob, and then it goes in, then unlock it, then it sits in there. Okay, and you guys please be gentle with all these machines
Yes.
and the connection, they're old.
And there's,
Right.
so camera, this part is the actual camera, this part is the part that's going into the box. These pins in here, If you guys just jam them into the box, they get bent. And then they won't show our pictures correctly, and you have to wiggle it and all that. So when you go to put it in, there's a blue arrow right here. Okay? If you match that blue arrow where it says camera with that arrow, you should be good. Okay? And still don't jam it in there, just kind of push it in there gently. Okay?
So blue arrow to blue arrow. Yep. All right.
No, you're good.
Yeah, it's this machine's a little broken, so it's okay. Well, let's redo this. Okay, T can keep passing it while I
Alright.
fix this.
Okay, here's our cautery. This is for our cautery. This is the side we keep. This is the side that goes off. Okay? Yeah, I was showing an error.
It's okay.
You see?
So this guy
Mhm.
goes right here.
Oh, okay.
Do you want us to actually
Okay,
plug
that's
that
fine.
camera plug in while we're practicing?
Yes, you guys are gonna plug all of this in. Okay, so your cautery cord, since we don't need to hook cautery up right now, just go ahead and stick it in your pocket. Okay, we won't need cautery until later.
And if you didn't have a pocket?
I would just put it, tape it up, actually put it in a loop and put it in here
Okay.
and secure it down. Just showing that red.
Yeah, it happened in the last quarter.
Let's switch cameras.
Because remember,
Can you grab me your other camera, Antonio?
Yeah.
There should be another camera box in there.
because one of the teeth got stuck in there, remember? Somebody
Yeah.
jammed it in.
Oh, yeah, it's in there. Yeah, actual camera.
It's the insulation tubing that's passing off. This is the cord. Okay? Set this over there. And then I'll go ahead and take the bogey out as well, please.
Okay.
Let me reset.
Oh, it's not on.
I have to reset it. I think that's it. So we can pick up the bogey.
You guys know the Bobby.
And same thing for those other tubings, if you didn't have the pockets, you would just make them a circle and then.
Yeah, just want to secure them. Mm-hmm. I'm gonna put the Bobby on your side too.
Okay, there you go. We're gonna be gentle to that. Okay. You got everything.
Out real quick.
Okay, Antonio.
Alright, count laps.
0.
Latex.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Plates.
1, 2,
Needles.
1, 2,
Typos.
1, 2,
Bogey.
1 Bobby, 1 scratch.
Penny cup.
1, 2, 3,
Pens.
1,
Thread.
1, 2, 3. Put some of this on there, and we'll stick thread wherever the doc wants it, but we usually put it like right underneath where they're working at. And then this, you want to put this where you can find it because it is a countable item. Okay, so we need to keep this with our countable items.
Okay. Any questions so far? Cords,
Do you
the
use the
setup.
towel print for all the cord or no?
You
You can. I usually do sometimes.
Okay.
Yeah, it gets really heavy and then the drip will start sliding down. So it's good to reinforce it, or if not, if you do a really good job with the Velcro, you don't have to.
All right,
Okay.
if we have time.
Allison has a question
yep.
behind you.
How many counts are there in this procedure? How many counts?
Same beginning count, interrupt count, and then your final count.
So
So three.
three.
Yep,
Okay.
yep,
Basically, all of our procedures pretty much have 3.
yeah.
Okay, put your ray text up. Now we're gonna connect the camera. You wanna start with 0 or?
Let's do 0.
Alright, so we're gonna connect our camera. The way we connect our scope to our camera, there's a little lever right here. Put it in, check it, make sure it's on there, okay? Next, camera cord, bottom right here. Okay? And that's, we're ready. So now I wanna ask the circulator, can you
Circulator.
please turn on the,
Come on.
turn us off of standby? So you're gonna go over to the box over here, Sherry will tell you what to do over
Yep.
there.
So this run button, go ahead and off standby. There you go, now the lights is on, you can see, right? And you guys can look at the camera so you can actually see.
So what we're gonna do next is we're gonna grab a Raytech and we're gonna white balance the camera.
Oh, sorry.
So we're just gonna, there's a W on this camera. You have to hold it down in order for it to work though. If not, it's just gonna make your screen bigger, okay? So we put this on here. White balance in progress, white balance complete. Okay? So our white balance is done, so our camera's ready. Now, when we go to set the camera down,
Sorry, we don't blind anyone.
so we're gonna ask for him to take it off standby.
Go ahead, take off standby. There you go.
Now, when you set your scopes down, make sure you don't set them on the mayo stand because the scope does get hot enough to catch this on fire.
Or the
Okay.
drape,
Or the
or
drape.
the patient.
Okay, so
Yeah.
whenever you set this down, you wanna make sure it's secure, but you wanna make sure that it's not up against anything that, it may, start a fire. Okay, it's happened before, somebody's like, oh, smoke.
Yeah. Smoke
And
coming out.
The light's burning the mayo stand cover or the drape cover,
Yeah.
okay?
Yeah.
So we wanna make sure that, this is in standby when we're not using it, and it's not laying against the mayo stand, okay? Alright.
All right, so there's several ways of doing laparoscopic entry. So one could be a cut down, which we're gonna show you guys. Cut down versus Varus needle. I'm gonna show you guys the 2 ways for now, okay? So let's go with the cut down.
Okay.
So we did, let's do timeout.
Come out.
You can make everything and all that stuff.
Okay. Patient's gonna be Barry Allen. Procedure's gonna be laparoscopic cholecystectomy. Weight is 92 kilograms. No known drug allergies. Our surgical technologist is gonna be T. Our surgeon's gonna be Sherry. Circulator Antonio.
Okay.
Alright, now Tavares, I'll be your tech for today. We're done laparoscopic cholecystectomy. Instruments are sterile as per indicator. I have 0.9% sodium chloride and 1% lidocaine with epinephrine 1 to 100,000.
Okay, Sherry surgeon, we're doing lap chole today, no anticipation but loss. Then let's get started. We're gonna do a cut down.
Okay.
Local.
1% lidocaine with epinephrine 1 to 100,000.
Injecting local.
Gonna use a 15 or a 10 blade today? I mean 15 or 11?
15.
Alright.
Needle down. Okay. Cryo. So what we're doing, we're kind of getting through, I made an incision, so we're trying to get things through like the sub-Q layer and then getting down to the fascia. So I'm just doing some dissecting, okay? Now, I'll take the coker.
Okay, with the coker, she's grabbing that fascia that she just went down for.
Okay, stitch. Okay. Okay, you can put the hemostat on. Cut. Okay. All right. What we're doing right now, we're doing a stay stitch, okay? And we throw 2 stitches down, and that's very standard for cut down procedures. So, okay, cut by the needle. Needle down. Snap. Alrighty, so now we put 2 stitches down, so it holds up the fascia. Okay, so when we put the balloon or Hassan in, we can insufflate and making sure that we're going through the layers. Okay?
Circulator, can you get my trocars from me, please? Oh, they already open? Okay.
Yeah, we open.
Check my Kim guard for me, please.
You guys want to push that in so nobody trip? Just push it button.
You're good.
Okay. I'll take the 12 balloon. And you guys can come closer now to like maybe this side and this side. Okay, so now notice when you hand this to the surgeon, you want to make sure this valve is closed, okay? So that insufflation does not come out after you put it in, all right? So now that because we have a cut down, we're in, sometimes the doc will use the S retractor to kind of make sure all the way through. Sometimes they'll use a cryo, sometimes they use a peon. So again, it depends on, you know, what the doctor's preference is, okay? Let's just say we're in now. So we're gonna put the trocar in. Okay, balloon. This is how you inflate the balloon. And I'll show you guys inside of the balloon once we get in the belly, okay? Okay, now it's in, there you go, insufflation tubing. Thank you. Okay, circulator insufflation on, please.
So insufflation is gonna be back there. It's gonna have to come around this way, Tonya.
Okay.
So when you guys are circulator, make sure you go around the best way that's gonna keep you from, one, being in the way of the surgeon and everyone in the field, and so that you don't get tangled up in all these cords.
This button.
Okay.
So start.
How did you pass the trocar?
Oh, just, just like they're
The
gonna
way
do.
that I'm gonna use
So
it.
our plug can't touch the
Yep.
trocar.
Yes, yes.
All right. Okay, insufflation's on. Go ahead and turn the lights on.
All right, lights on, please. Camera light, lights down. Yep, circulator's gonna be running.
Alrighty.
The lights down.
Turn the lights off in the room. And then because our OR lights, our bulb does not work anymore, so T and I bought these so that this is our laparoscopic. Oh, well, not that
Party
one.
Well, no, they'll go back, White. They'll go back, White. You need the remote.
If you switch
Oh,
it all the way
yeah.
over, it just stays.
No, I
Yeah.
think it stays.
No,
Hold
you
on.
need the remote.
Okay, there you go.
All right.
All right, so now we're in, we can take a look inside. So, wanna make sure we're insufflation is on, we have full insufflation in the belly now. And you guys know what the insufflation should be for standard?
15 to 17.
Yep, that's right. Okay, so now we're in, we're gonna take a look at inside. All right, so you can see we're looking at the anatomy and here's
And
our
if you guys notice,
gallbladder.
while Sherry's doing all that, I'm taking care of this stuff, about to bring my laparoscopic stuff up. Okay, so all of the stuff that we used to get in, we're gonna take that off and we're gonna bring our laparoscopic stuff up so that our Mayo stand isn't a mess. And like we were telling you guys with your other procedures, you know how when the doc's doing something, we have time to do our little things. So this is the time, once they're getting in, looking around, I'm gonna start bringing down all my stuff that I got in with and start bringing up all my laparoscopic stuff. Make sense? Okay.
All right, so I went in with a 0 camera, okay? So 0 camera meaning you can only see directly what's in front of you, okay? For those of you that play video game, you will understand, you'll learn it faster because you know how to maneuver. When you're looking at the screen, when you're turning right, it's actually facing the other way, okay? So normally the doc would go in with a 0 degree so that they can see what they're looking for, okay? And then now let's switch to the 30 degree.
Okay. 30 degrees.
Yep, here you go.
Better?
Yep. All right. Thank you. All right, now let's put the other trocars in.
Okay.
I'll do the 2 5s today. Okay. Needle.
Got the camera?
Camera. Injecting needle.
Oh,
Local.
yeah, let me find you real quick.
Right up here. Okay. All right. Knife. Can you come by find me up here. There you go. Okay. Knife down. Okay. Trocar, so you want to find where the surgeon is placing the trocar, and we try to follow the surgeon so that we're making sure we're not getting into any other organs. Okay. So we come in. Okay. And all local. Okay. Injecting for another site. Okay. You come find me. Yeah, there you go. This. There you go. Okay. Injecting more local. Knife. Okay. Like, 5. Here's the other 5. Alright. Okay, let's switch the insufflation to the 5.
Okay.
Yeah, and a lot of time we switch it to 5 because most of the time the port that has the camera in, you don't want insufflation, it fogs up. Okay, your blade is still up. Alright, so now that we are in the proper position, we normally ask the anesthesia staffing to go Trendelenburg, meaning that we go in this deep Trendelenburg so that we can help to lift up the liver, okay, to position the patient. A lot of times they also call it the Chole okay? So we're not gonna play with this bed because it's old and we don't want you guys, to get hurt. But we will announce it during the test. We will go Trendelenburg, okay? So now we're out of Trendelenburg. Now let's go look for the gallbladder. Okay, in this procedure, you guys will be running the camera, okay? It's just you and the surgeon working, okay? And a lot of times, most hospitals, they sometimes have residents or PAs, but a lot of times it's just you and the surgeon doing the case, okay? All right, I'll take the procedure and camera to you. Right. So, then you'll come find me first. Coming down. Okay. Now we are going to the gallbladder. Got a hold of the gallbladder, and normally we'll lift it up from the liver bed, which lifts the entire thing up. Later on, we can watch a video and we can kind of go in deep discussions about it. Okay, just showing you a lot of pretending here. So we're lifting the gallbladder up. Now we're gonna dissect around to find the 2 structures, right? And what are the 2 structures? Okay, so, all right, I'll take the Maryland. Find me, and then I will go in here and dissect. And now I found the 2 structures. What do I do?
Can I get a
Cut time?
Yep, so
Can I get a clip of plier, please?
clip a plier.
Excuse me.
And then, you said that's on standby.
Yep. All right, so if you guys notice, this is a what size? 10. So looking at my ports, which one can it go in?
The camera.
The camera port. So now we're gonna have to switch the camera out. Does that make sense? So 5 can only go in 5, 10 can only go in 11 or bigger. So it'll be a 12 or 15. Okay? All right, go ahead and take the camera out, and you can switch it in this port. Yeah. There you go. Okay. All right. So now I'll take the clip applier. Ready? Okay. All right. I'm gonna go in here.
Against the wall.
I'm stuck on the balloons, I think. But you will go in and do clip and clip. So total of 6 clips. Okay. So 3 on the artery and 3 on the duct. Okay.
Using 2 proximal, 1 distal.
Yep. And then the proximal end, normally we will do the 2 because that's still attached to the patient and it will stay in there. Okay, the distal will do the 2. So it's the same thing, clamp and cut, but we're doing clip, 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 and then cut. All right, it's the same for the artery and the duct. All right, so I did that. I'll take scissors. So surgeon can ask for mesh or hook scissors. Okay, so we'll go in here and cut.
Everything sharp?
Nope, nope. So okay, it's cut, and then I'll take the endo bag.
Can I get the endo catch bag, please?
Alrighty. Okay, so we're gonna go in this port. Alright, come in. Back up a little. There you go. Okay, alright. We will deploy the bag, which I made a fake bag inside, the endo bag, so you guys will take that out. Okay, so we're kind of skipping that process because most of our
If we
bags
open
are
it, we can't
donation
close it.
and it doesn't close. This is already deployed. Okay, so it's not here anymore. But essentially, when you push this out, the bag will come out. Then you will, it's an open bag. Then you'll put the gallbladder into the bag and then come out. Okay? So before doing this, we'll actually use the hook cautery and burn the entire gallbladder off the liver
the liver.
bed. Okay? And then you want to show me the hook cautery? Do we hook it up yet? Okay.
Okay, so you got a camera?
Yep, camera back.
So that's when we're gonna take out our, and that just connects on the end of that, and it's, this cord is connected to the Bovie, so it's
Yep.
just like a.
Right. And then I'll need my
Bovie,
pedal
pretty much.
nearby. So I will
I got
step
the
on the
camera.
pedal. Yep.
So that one should already be turned on, so we don't need to tell the circulator to turn on.
It's already turned. Yeah, it's
Yeah.
already turned on. Part of your turning on process.
Okay.
Yeah. Yeah. So I will go in here, just burn, 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 and then you can set that up. Okay. So we did the bag coming out. So we're done.
Lights
Yep.
up.
Lights out. Lights up. Camera's off.
So you got the camera?
Yep. Got it. Can someone turn the lights back on? Alrighty.
I have a question.
Yeah.
In the actual OR, that light will actually be helping light up.
Normally this side, yeah.
Yeah.
Normally it'll be like pitch
Yeah, or
dark.
we'll take the light and put it over our
Yeah.
table so we can see.
Okay, cool.
Yep. Okay, so now, which port do you guys think the gallbladder is gonna come out?
The big one?
The big one. Okay, so, and sometimes the lights will be on, then we will look at the side. It just really depends on the surgeon. We will look at the inside abdominal wall to make sure there's no bleeding. Okay, so we will take the trocars out. We're done. Insufflation, everything is up on standby. Then we will try to take the gallbladder out from here. Okay, syringe to deflate. Okay. Alright, you guys, so when you're inside the abdominal wall, this is what the balloon looks like. So it stays in.
So all our trocars go on the dirty face.
Yeah, you can put them in there. I just put them in there and get them out of the way.
Okay, peon. Okay, so a lot of times, the gallbladder, the bag is kind of big. The surgeon will use a peon to extend and stretch. Okay. Then now the gallbladder will come out in the bag like this. Okay.
Specimen?
Yep.
Would you like it called?
Gallbladder.
How would you like it sent?
Permanent at the end.
Alright.
Yep. Same routine. And in
And
most,
this is in the bag.
yeah.
I usually just put it at the end if they don't need
Yeah.
it right now. And then once I get time, I'll give it to the circulator.
Yeah, and most places, it depends on the facility. Some facilities, they want you to cut the bag and dump
Yeah.
the gallbladder out. Some, they want you to keep it in the bag. So it depends on where you go. Okay. All right. So now I'm just gonna use my stay stitch to close the fascia. And now is the time that you'll do count.
Alright, can I get a count?
Okay, laps.
0.
Wait.
1, 2,
New
1,
rate
0.
test up.
1, 2 on the field.
Okay.
3, 4, 5, 6, 7, 8, 9, 10.
Okay, blades,
1, 2,
needles,
1, 2. Right,
hypos,
all
Yep,
good.
yep.
1, 2,
bobby,
1 bogey, 1 scratch.
hitting cap,
1, 2, 3.
Okay, I'll take my skin. And for this procedure, we are going to ask you how much local is used. So at the end of the case, just let your circulator know how much local is used.
Have Fred, 1,
oh, Fred,
2, 3, and 1 bad.
one bad, okay.
And surgeon may also ask you
Sounds
at the end
correct.
how much local is used. Thank you.
How are we simulating that? Are we just saying, oh, there's 5 used?
Yeah, so
Yeah.
we will actually inject the local out.
Okay.
Yeah.
Yeah, we'll actually
Okay.
use some. so
Yeah.
you
Oh,
can
okay.
Yeah,
tell.
we'll use some. Yep. Okay, cut. By the needle.
Good.
Yep. There's that. Okay, so we're done. We closed all 3 sites. Now what do we do? Irrigate, yep, so pretty much wet and dry. Irrigation will be inside, but let's do wet and dry, and then same thing, you ask for dressing.
Wet and dry.
Yep, same thing, dressings.
Do you know instrument count?
Yeah, that's what I was gonna ask.
Does that what?
Instrument count?
We just did our instrument count. So when we're like, we'll laparoscopic. Usually when we're closing fascia, these holes are really small. So we may only do one, our beginning count and our intra-op count. And we'll ask the circulator, some circulators, they wanna count, even if it's just that little,
Yeah,
fascia stitch. They'll count and then we'll count right again, right when they get it skinned.
yeah,
Okay, so it'll be like 2 counts back to back,
yep,
okay?
yep.
So,
And depending on the facility,
yes,
some facilities, you always count instruments in all the laparoscopic case, but you don't do one at the end. Does that make sense? Just your initial count, in case we go open.
So do we have count sheets for these?
no.
No,
Okay.
yeah, we'll make one.
They will have count
Yeah, but
sheets,
they normally do. These instruments are all the same ones that you guys already know. So we can tell Chris to make one for you guys. Okay. Now I'm gonna show you guys a Varus needle way. Okay. So let's not hook up everything like we already
Yeah,
know how to do
here's
this
your 0
part.
degree.
Yep.
And
So
here's your edge.
Varus needle, the only difference in the beginning is the same thing, injecting local, knife, and a lot of times some surgeons will use the 11. So 11 blade, so I'll just do 11 blade poke and Varus needle. This is the Varus needle, okay? This will go in through the fascia. This is a non-disposable one, so it's a little different. And let's grab the disposable one too so we can show them. Most surgeons don't use this anymore. It's very old school. Yeah. We put it there. No?
Was it the one that was on our test?
Yes, that was on your tab. Yeah.
Oh, here it is. No, that's the yeah, we don't have one up here, but it's the one with the white tip. Have you guys seen it? The one that was on your instrument test.
Yeah.
That's the disposable bearers.
The one that we didn't count.
Yeah.
That was weird. I brought
Yeah, I
two
thought
out.
it was up here.
Okay. So you will go in and they'll do a saline test drop. So saline test drop, meaning that if I were to do the Varus way, you gotta make sure you label your saline on this 5cc syringe. Okay? What this does is it's just testing whether making sure that this Varus needle went through every layer into the abdomen. Does that make sense? So if you drop saline, it will go all the way down. Then we're gonna ask for the insufflation tubing. So a lot of times, we put the insufflation on, we'll let it insufflate, and then we'll just kind of hang out here until it's insufflating. Some surgeons, as it's insufflating the stomach, they will put in the other ports at the same time. Okay, so for this particular, we're gonna do this. So insufflation, we're insufflating, and we're gonna do an octaview. Okay, octaview meaning that we are putting a zero lens into the obturator. Okay, and we're going through within the fascia, so that
That way
you
they
can see
can see the
different layer.
trocar going through the
Okay.
different layers, so we don't puncture the bowel or anything like
Yeah,
that.
and then let's, you know what? Let's turn it on it just to show
Okay.
them. Okay, can we have the light on? Anyone can hit it.
So will part of our setup also be labeling and filling out
I don't
syringe
know.
as well?
Correct.
Yes.
Yep.
Okay.
Is it this
That
one?
one.
Yep.
And this is one of your procedures. You
Yep.
can have a few different medications on your table. If we're doing cholangiograms, you'll have some kind of high pick.
Yeah.
You'll have some kind of local. You'll have your irrigation. So you have we have a bunch of different.
Yeah.
We can have a bunch of different stuff that we need to label on our table for
Yeah,
this.
and we'll show you guys
Yeah.
the OmniPick.
That one we keep
Not
empty
now.
for air, right, for the balloon?
Yeah,
Yeah.
yeah.
Yep.
Okay.
It'll
Okay.
come with that.
Yeah,
Just
it
like
comes
this.
with a 12.
Oh, okay,
You see?
It'll come
Yep.
with this.
Okay.
Okay. So now again, same thing. You white balance. Maybe. Okay. And then now you will stick this guy in. And when you're handing to the surgeon, the only difference about the OptiView is that you have to focus within the trocar, the obturator. I mean. Okay. So you see, this is clear. This is blurry. But out here, this is actually clear. Does that make sense? Because it's closer.
How are you adjusting it?
There's a little knob right here that you can turn left and right. Okay? So now that we're in, we have to make sure it's focused. And the reason we do that because we are gonna go in with the trocar. So you can see the different layers going in. Okay, once we're in, hold the camera, the obturator comes out, then it goes in, then it's all kind of blurry, right? Then we adjust it again to make it clear. Good? So I'm only gonna show you the two ways for now.
Yeah, for now.
For
Yeah.
now.
Yeah. It's a lot of information. Yeah. And it's all very similar, right?
Yeah.
So sometimes they insufflate, they don't do the OptiView, they just go in. Sometimes they just go straight in.
It's
It
just
depends on the
doctor's
surgeon's
preference,
preference. Okay? But these are the two common ways. But it's called the OptiView. OptiView versus cut down.
Cut down.
Okay, all right. We can have light off,
Lights on.
room lights back on, please.
Are we gonna learn the like circulator stuff separately again?
Yes.
Yes.
Mhm.
Okay.
Yep.
Stand by.
Yep. Yep. But I want to make sure we do the setup and then this part so you guys can, get
Yeah,
started
once you
with
guys
this.
get,
And really, circulator, it's the same stuff. It's just you opening stuff for them, you hooking up this, the lights on, lights off, lights on, room lights off, kind of thing. And count. So I don't think there's a huge difference, but it's the same.
alright, when
Yeah,
you
just
guys
different procedure.
are putting your
Yeah.
cords up,
Okay.
okay, when we're taking these off.
Yep. So circulator, Malia, can you unplug for me? So this will be part of the test, okay, as a circulating roll. So circulator will unplug everything, and then go ahead and gently put it on the floor. And you and the tech will move together to move all the cords back. So go ahead and remove everything. And then remove that guy, turn the knob. Yep, turn the knob and hold on to the cord at the same
Turn
time.
it up or down?
Down. Yep.
Sorry.
Yep. Okay. So you guys will move this T. You want to show them. So you will move. So everything
Yep.
here below it's
So,
not
yep.
sterile.
And
This
I've
is
already put
sterile.
my end in, cause I wanna stay sterile.
Yeah. So hold it. Go with. So you are gonna go with your tech to the side and make sure you don't contaminate anything. So this part's gonna stay sterile. There you go.
Okay, and you can just set them down over there.
Then gently set it
And
down.
then, yeah, bring them from the bed and all that.
Yep.
And that's just in case we need to hook back up. So we wanna keep that stuff sterile.
Make sense? This part? Yeah, you just have to do it together. Okay? I think that's pretty much it for the procedure and the setup. It's gonna seem a lot right now, but it really isn't. It's not a complicated procedure. So it's a lot less than small bowel.
Yeah, it's
Or
probably
even
harder to
openness.
learn to run the camera
Yeah.
than anything.
Yeah. Yeah. But I think for the people that know how to play video games,
Yes,
they're
you'll be
normally
good.
really good at this part. But yeah. And just try not to, just play with it. You guys all work in different groups and try to drive the camera. If you, at any point you feel sick, like motion sickness, step out. Because it will happen to certain people.
Some people.
It's happened to me too.
No,
So
seriously, yeah, when you got someone who can't hold the camera still and you're just like.
they're just shaking. No, I've actually had a resident make me sick, and I'm like, I need to step out or I can hold the camera.
Yeah,
Because, I got motion sickness from looking at the screen and it keeps moving. So, it will happen. So, but yeah, so if you feel like you're getting not like sick and, not feeling well,
Yeah,
just
just
step out
yeah.
and get some fresh air and you'll feel better.
And there should be everything on that side that there is on this side. If there's not, just let us know and we'll fix it.
Yeah.
And then it's gonna show us how they do the arms.
Oh,
Yeah,
on board?
yeah. But any questions for this part?
What position do you want that in?
This?
Yeah.
It should be right next to my foot.
Yeah.
So I can step on it. Yeah.
Like to the side of you, you don't want it in front of you, so.
No, to the
Yeah, off
side,
to the
normally in
side,
front,
yeah.
to the side kind of thing. Once you put it here, they can use
They'll
their
move their
foot
Okay.
to like
Yeah.
move it to where they like. But yeah. Again, same. It's the same as Bovie. One's coax, one's cut. So coax is just to burn, cut is to cut. Yeah. Okay. So on board. Oops, this came off. Just real quick, guys. So on board.
So that's what it looks like without the cover on it, okay? The way these hook on here, okay, there's this edge right here, and then there's this little thing. You have to push this down, and this is only gonna go on the edge of the rails, okay? So when you go put it on, angle it, and then let that go, and it should be on there, okay? To move it, just move this up, lift it up a little bit, and you can slide it back and forth.
Yeah.
To angle it, there's this right here. Once it's on the bed, just pull it out and you can move it. Otherwise it won't move, but if you pull this, you can move it sideways. And then this lever, you can adjust on the rail. Okay?
How do you drape it?
Oh, just put it on.
Okay.
Yeah. This is not sterile.
We're not. Yeah, it's
Yeah,
not
this
draping.
isn't
This is
sterile.
not sterile.
Okay.
Yeah, we're
This is just
yeah.
keep the patient from being on this,
And keeping
Right here,
fluids on
yeah.
that. It's just disposable. It's like trash. So all
Yeah.
this bed sheets and stuff, they're all trash. It goes to trash every case. After every case. Yeah. That's just like a protector so blood doesn't leak all over when they're
get all in the
lines and-
pads
Okay.
and all that.
Yeah, yeah. This is not draping.
No,
Nothing,
not
nothing is
sterile.
sterile here.
Okay.
Yep. So here's that.
Does it tech do this? Or the circulator?
We all do.
We
We all
all
help
do.
each other.
Yeah, it just depends.
Yep.
A lot of techs, what we do is, once we get set up, because sometimes we're set up way before the patient comes in, we help do all of this. We'll help
Yeah.
get the bed ready, we'll
Put
help
the
position.
CDs on and help position the patient, and we do all that stuff. Yeah. Like I said, you gotta work closely with your circulator. You're, it's you and the circulator. You guys are the partners, like in the room. So you guys depend on each other. So you guys gotta have to communicate. Yeah. Stay on this side, and then just kind of straddle down. Yeah. And we will never overextend the arm, but this is,
Yeah.
Dummy here doesn't extend that much, but that's it. Any questions?
The local, how accurate will it be?
Pretty accurate. Like, I mean,
Yes.
like, I will, so what we'll do, we will inject local, then you should be keeping track of how much local is used. So every time you get local back, for example, can you pass me the local? So let's just say, for example, let's say you got 30, okay? Next quarter, we will emphasize on how much max local per patient. But this quarter, for this particular test, just make sure you always fill up to 10, okay? So every time when you hand me a syringe, I inject local. Let's say I do this. How much is this? How much did I use? 3, exactly. Then you will keep track of 3. Okay, so this is where your glove wrapper comes in handy. That's your scratch paper, notes. You take notes throughout the case. Okay? Now, every time you get it back, I want you guys to get in the habit of reloading again. It doesn't matter how much I use. Every time you hand surgeon hypo syringe, it should be full. Okay?
Oh, okay.
Yes.
But we're not gonna grade you on, cause there's a
No.
lot of sharp handling, and
Yeah.
next quarter we will really get on you guys on this, because it is our job to write down how much medication's used. And sometimes it's not just the local, there's other types, 4 to 5 other types of medication on your field, okay? So, you hand it back to me, it's 10 again, then I will inject again, let's say, how much did I use? 5. So you need to keep track, 3 plus 5. Okay? At the end of the case, I might ask for a local again. So you gotta make sure you fill it back up again. I'm gonna use some more. Then let's say I use another 5, then you gotta add up the final number to the circulator. And then surgeon may ask, hey, how much local was used? Because I need to put it in my chart.
And I
Yeah,
saw
you-
you, I'm sorry,
Go
I
ahead.
saw you take off the lure lock and we could just fill it up like that.
Yeah, it's
Yeah.
easier to take it off and do
Yeah.
it like that, yeah.
Do this.
But you said for this case, we don't have to worry about refilling it, so you're not gonna use more than 10 this case?
I will. So like,
Okay.
I'm not gonna do it where it's like I want you to be hurt. Like I won't
Constantly
constantly
getting local.
doing it.
Okay.
So I won't do that this quarter. But next quarter I will.
Okay.
Yeah. So that you guys get in the habit of refilling. Just be
Yeah.
ready.
Just
Get
be
in the
ready. The flow.
groove of doing the
Yeah.
flow of things, but not like I'm not gonna do it every time.
Okay.
There are some surgeons they are very particular. They want the syringe to be filled 10 every time you hand. So and they'll get on you if you don't.
And you still only want 10 milliliters in our med cup?
Well, we may start out with 30.
Yeah.
30?
Yeah.
Okay.
Yeah, because next quarter I will show you guys, depending on the patient's weight and how much local you can give,
Got it.
but not this quarter, okay?
Okay.
We just want you to get in the routine of doing this loading, putting it back.
And then after you guys, a good time to think about doing that is after you finish your count's correct, I've used so much local.
Yeah.
Okay.
Okay.
Yeah, get in the habit of doing that,
Yeah,
okay?
just in the habit of saying it, cause they're gonna ask.
Yeah,
Yeah.
and probably next week I'll show you guys the cholangiogram.
Yeah.
Does anyone know what cholangiogram is?
Yeah.
What's a IOC?
Just read it.
It's coming out.
Just get over it,
Yeah.
I know you're taking an image of
Radiology.
It is.
Yeah,
Intraoperative
intraoperative.
cholangiogram. So, you're close. You guys all have the right idea.
They use contrast.
Exactly. So, when we have contrast, you gotta keep track how much contrast is used, because that's medication,
Yeah.
right? You inject it in the patient, and we gotta keep track of that, okay? So, we're not gonna show you that today, it's too much, so probably next week. Once you guys get the flow of things, then
Yeah.
we'll show you the cholangiogram. Interrupt cholangiogram, just a lot of time it's because their duct is so inflamed that sometimes endo didn't do the stone part, and they have stone kind of stuck in between the duct into the small intestines. So they will need to shoot a gram just to make sure that there's no big stones that's stuck in between. If they do, there's a couple options. Sometimes they'll send them back to endo, they'll do an ERCP, or they'll just, there's something called intraop camera that you can scope that you can use, it's called a spyglass, and it goes into the gall duct, like it goes through the cystic duct. Then you can retrieve stones that way. But we're not gonna do that here, but I'm just letting you know, that's another option. So they just wanna make sure the stone, passed, or they retrieve it, okay? Yeah, that's pretty much it. Setup, you guys good? Yeah. Okay. Alright, you guys,